Dr. Paul here. Welcome to our science segment of Against the Wind. Doctors in Science on fire. No, we're under fire. Luke Yamaguchi, good friend of mine. Thank you for coming. You are a scientist and a functional nutritionist, and I know you're a really deep researcher. We've had lots of discussions in the past, and even though we may not always agree on things, I like how you pursue things in great depth. So you knew I was tackling the topic of COVID this time go around. Let's start with the informed consent arena. Sure. As pertains to COVID and the COVID-19 vaccines. What are your thoughts about that?
We talk about making an informed medical decision. We need to know the risks, benefits, and alternatives to any given treatment or intervention, whether that's prescription drugs or chemotherapy or surgery or vaccines.
Right.
And so in the context of COVID-19, I think it helps to start with an understanding of the baseline risk of the disease itself. In other words, what would be the risk if you decide to not get the vaccine and take on the risk of the disease itself? And so the interesting thing about COVID is that the risk is highly stratified by age. And that is to say that as we get older, the risk of dying from COVID increases.
Okay.
So to give you the numbers, 0 to 17 years old in the United States in 2020, there were 177 deaths involving influenza. This is the CDC's own data. Now for COVID-19, almost the same number, 179 deaths involving COVID-19 in the United States in 2020 for all children 0 to 17.
Right.
So that means that basically for this age group, children in the US, influenza and COVID-19, they're just as deadly. And so the reason why I start off with saying that and mentioning that is because I think there are probably some children out there and parents who have children, and maybe these kids are like actually legitimately terrified and wondering like, if I get COVID-19, am I gonna die?
Right.
And I just want them and their parents to know that at least last year in the US, if your kids aren't afraid of dying of influenza, they shouldn't be any more afraid of dying of COVID-19 because the deaths were basically the same.
I like where you're going with that, and I would add one more caveat to that, and that is that almost all those deaths, both influenza and COVID, were actually deaths from something else. So these were kids who had underlying heart conditions, multiple comorbidities, as we know is a big factor with COVID.
Immune compromised in some way.
And it's no different with COVID as it has been in the past for influenza.
Yes. Yeah. So that's the case with children. Now if we go to the other age extreme and look at, say, older people, 70 years and up, then the disease is much more serious. And we see an estimated infection fatality rate of about 5.4% for the elderly. And this is similar to the infection fatality rate of another infectious disease called C. difficile infection, or C. diff for short. It's also infectious but fecal-oral route. It's a life-threatening kind of diarrhea.
Yeah,
and it
predominantly in hospitals a lot.
Yeah, typically after taking antibiotics, people can get it. And it predominantly affects older people much more severely, just like COVID-19. So that's kind of like the one extreme and the other extreme in terms of the risk of the disease itself. Right. And if we look at the overall infection fatality rate for all age groups for COVID-19, it's actually less than 1%.
Yeah.
So less than 1% overall infection fatality rate. And we can compare that to, say, other historical infectious diseases of the past, like, say, smallpox, which is said to have had a 30% fatality rate. So maybe like 30 times more deadly than COVID. And so I don't want to trivialize the severity of COVID, because obviously for older people with multiple comorbidities, it is a serious and potentially very deadly disease.
Right.
But I also don't want to blow it out of proportion either.
Yeah.
To the extent where now, like little children who are at very little risk from the disease, the same risk that they'd be at as dying from influenza, are now afraid that, oh my God, if I get COVID-19, I might die. So I just wanted to
thank you for saying that. I think, it's a point I've been trying to make to our audience, that it's this fear that is pervasive, right? You turn on the TVs and it's all just fear, fear, fear.
Right.
That's not good for our immune systems.
No.
It's not good for our brains. It's not good for our social well-being. We need to be in connection with others, but we're so afraid that we're isolating and quarantining, and that's another whole story. But I love your emphasis on how to rationally look at this.
Yeah,
that's a good point. Knowing that risk now, when we look at our options, I know because you're a functional nutritionist, before you get out of here, I'm going to ask you about what we can do in terms of nutritional and other things. But when you turn on the news, it's all about the vaccine.
Right.
So give us your thoughts about that. There certainly must be risks and benefits.
Right. So let's start with the benefits or the purported benefits of the
Yeah.
COVID-19 vaccines. And I'll be speaking specifically about the mRNA ones. So this
Okay.
is Pfizer and Moderna's
Right.
mRNA COVID vaccines. And if we look at the clinical trials, I think everyone has probably seen on the news and media like 94% or 95%
Right.
effective. And it sounds really great.
Yeah.
And my understanding of that is that in the clinical trials, the people who received the COVID vaccine had a 95% reduced risk of developing symptomatic COVID compared to the placebo group. And at the
Correct.
time that was made, that was based off of actually less than 200 total infections of COVID, even though there
Correct.
was like maybe 30 or 40,000 people in the clinical trials
Correct.
on the whole. But we don't know yet that. So it does seem that the vaccine is effective at preventing symptomatic COVID, but we don't know if the vaccine can prevent people from being infected with the SARS-CoV-2 virus. That's the virus that causes COVID-19.
Right.
And then perhaps be able to then go on to spread that virus to other people, even though they've
We
been
don't know if it'll prevent that
vaccinated.
either.
And so this is why Tony Fauci has been saying, that, well, even after you get your vaccine, you still need to practice social distancing. You still need to wear a face mask or 2 face masks or whatever it is.
Right.
Because we don't know if it will prevent infection and then being contagious and spreading that to other people. And we've actually seen this with another vaccine on the market, which I'm sure you're aware of. The acellular pertussis vaccine has this precise problem
Yep.
where it may prevent the symptoms of whooping cough, but you can still
reduce them.
Or reduce them, right?
Right.
Because it doesn't
Doesn't really
actually
prevent them.
right? In some cases, but
Some-
not
it
not
might.
all cases,
Right.
right? But it doesn't necessarily prevent you from being colonized by the bacteria that
And
causes
still transmit it to others.
and still transmit it to others, maybe even as an asymptomatic carrier. And actually, this is straight from the CDC's website, so I'm going to read it off to you. I want to quote it so I do
Okay.
it justice. So, the CDC's website says, public health experts cannot rely on herd immunity to protect people from pertussis, since acellular pertussis vaccines may not prevent colonization, carrying the bacteria in your body without getting sick, or spread of the bacteria, end quote. So that may be the case as well with the COVID vaccines. We don't know yet. It may not be the case, but we just don't know for certain one way or the other at this point. So we also don't know about the vaccine. How long is the duration of protection, right? Because the
Right.
clinical trials have only been going on for
months.
however many months,
Yeah.
a few months or so. And we don't know how effective the vaccine will be at preventing the different variants and
Right.
mutations of the coronavirus now as well as in the future. It appears that these vaccines may actually be less efficacious against certain strains of the COVID vaccine, COVID virus, like
Right.
maybe the South American strain or other strains.
Yeah.
Another thing that we don't know is whether or not we'll need to get another COVID vaccine booster shot every year for the rest of our lives in order to be protected from this disease.
If it even protects us.
If it protects us. Now, just spoiler alert, but the CEO of Pfizer, I think, came out and said that's exactly what we're going to have to do. Is there's going to be an annual
Of course.
COVID vaccine booster shot, just like we have with the annual flu shot nowadays, and that's kind of what we're looking at in the future.
Yeah.
Right.
Back to your data, though. So let's take the vaccine trial that had 30,000 patients.
Okay.
And they picked the healthiest of healthiest. They screened out all the high-risk people.
Right.
And in those healthiest of healthiest, once they had less than 200 positives, they said, let's look at what number were in the placebo group and what number were in the vaccinated group. Oh, most of the ones with mild symptoms were in the placebo group. So the vaccine's effective
Right.
at reducing mild symptoms.
Right.
Well, out of 15,000 placebo group patients, if there were 100, which is approximately the number actually, who had mild COVID symptoms, there were 14,900 who did not. So that placebo is highly effective at
Right.
preventing any disease, is it not?
So I think you're pointing to the difference between maybe like the difference in a relative risk reduction of 95% and an absolute risk reduction. So the absolute risk of getting COVID in that short 2-month duration
It's
of that
very low.
was very low.
Right.
Right. So,
Right. So what they played with was a relative risk using really low numbers.
correct.
Which, what that really represents, who knows? We also know it didn't prevent hospitalization or deaths. They just didn't have any data for that.
Yeah, so Peter Doshi wrote, he's an associate editor of the BMJ, the British Medical Journal,
Right.
and he published something in October, I believe, of last year, where he was saying the clinical trials for the COVID vaccines were not not designed actually to assess the difference in severe outcomes like hospitalization,
Right.
intensive care use, and deaths.
Right.
So
So by design, they were not going to answer the question we really need.
they didn't
I
have
don't
the
think-
statistical power, I guess, is the problem.
Well, they weren't set up to go long enough to get the answers that we need.
Yes.
Would you agree?
Yeah, but yes, for that point in time. But I think as time moves forward, we'll get more data and we'll be able to answer those questions a little bit better moving forward would be my hope.
Hopefully. There's one problem. I'm reading, I don't know if it's happened yet, that both the Moderna and the Pfizer group are planning to vaccinate the control group
Right.
because it's unethical not to.
Right.
That ends the trial.
Yeah.
So then we won't ever get the data.
Right. So that's a problem.
Then we're going to rely on VAERS vaccine. It's a passive surveillance system.
I'll get to that.
You're going to get to that. Okay, I'll let you get to that. Yeah, that was fun. Thank you for letting me spar with you a little bit. I want good data, folks. And when we're having fun like this, just sparring, there's no right or wrong here. It's just data. But let's look at it carefully and understand what it really means. And I know you're a hardcore scientist.
I mean, and I think that it's important to debate these issues.
Yeah.
Like good rigorous science encourages debate.
Absolutely.
It welcomes it. It says,
Absolutely.
we know we're solid. Like
Right.
hit us with whatever you got.
Yeah.
We'll defend this science
Yeah.
because it's so strong.
Right.
And so when we see censorship and just shutting down any kind of conversation or any kind of criticism, it's really unscientific and it just is not the proper way to do things. We should be able to have open debate and conversation and ask hard questions.
Absolutely.
And be able to bounce ideas off of
Yeah.
one another and talk about these
Yeah.
things is so important.
Yeah.
So getting now to the risks, some of the risks of the vaccines, and I'll be speaking specifically about Moderna and Pfizer's mRNA COVID vaccines.
Okay.
So this technology, this messenger RNA technology, is a first of its kind technology. It's never ever been deployed in a mass vaccination campaign in the history of the world ever.
Right.
It's not actually even formally approved by the FDA. It's just been given an authorization for emergency use.
Mm-hmm.
So in a very real way, it is an experimental vaccine because we just, as you pointed out earlier, don't have the long-term safety data for it. It just doesn't exist.
So are you saying that anybody who rolls up their sleeve for one of these vaccines is volunteering for an experiment?
I would say, yeah. I mean, just because we don't have the long-term safety data, we can't say for sure, like, this isn't going to affect your fertility
Right.
5 or 10 years down the road.
We don't know.
We don't know. The
Right.
data just isn't there.
Or your autoimmunity.
Right. We just don't know.
Right.
We don't have the answer. We don't have the data to answer
Right.
that question. So that's, And so to highlight that point, there was actually a slide that was put out during a presentation in October, I think, of the last year. It was an ACIP meeting. So ACIP is the, help me out here, Dr. Paul, ACIP, the Advisory Committee for Immunization Practices.
That's it.
Yeah. So, and on this slide, they were listing like the different possible adverse events following vaccination that they wanted to keep an eye on with their surveillance systems moving forward. And it lists things like heart attack, stroke, convulsions, seizures, thrombocytopenia, which is low blood platelets, autoimmune disease, vaccine-enhanced disease. And some of these things we've actually seen, like there was the one story that made the news of the pediatrician in Florida. It was very sad. He got the vaccine, developed ITP, idiopathic thrombocytopenia, had a blood platelet count of zero. And then died 2 weeks of a hemorrhagic stroke later, 2 weeks after that. So,
and these stories are coming fast and furious now.
Right.
Of all of those things.
Yeah, and they're being censored on social media, which is very sad.
Yes.
So that was just a list of the possible adverse events that they were going to keep an eye out on. But if we look at the reported adverse events following vaccination that have been reported to the system you mentioned, VAERS, the Vaccine Adverse Events Reporting System, we see that there's been over 1,000 reported deaths. There's been hundreds of life-threatening adverse events, hundreds of cases of permanent disability, and thousands of hospitalizations and emergency room visits following COVID vaccination reported to this system, VAERS.
Right.
And VAERS, as you mentioned, is a passive surveillance system. Historically, it's been accused of having really underreported the vast number, like maybe just 1% of all total vaccine adverse events are reported to the system. For things like deaths with the COVID vaccine, because it's mandatory now, I think that number is probably much higher, but we don't really know. And the thing to note about VAERS is that the problem, one of its weaknesses, is it can't prove causation. It can only show the temporal correlation, meaning they got the vaccine and then after this amount of time they had this adverse event. But if we were to look at the clinical trial data of, say, Moderna's vaccine, it actually shows a pretty serious adverse reactions profile, or I should say a high percentage of adverse reactions. And so this is from the fact sheet of Moderna's own fact sheet. They say that 92% of participants who received Moderna's vaccine experienced pain at the injection site, 70% had fatigue, 65% had headache, 62% had muscle pain, 46% had joint pain, 45% had chills, 23% had nausea or vomiting, 16% had fever, and 15% had swelling at the injection site. And that's not even all of them. I didn't list all of them.
Those are all acute reactions. We haven't even looked at the chronic.
Right. So those are
Sign me up.
Those are adverse reactions. So they're admitting that the vaccine caused those adverse reactions.
Wow.
Oh, one thing I forgot to mention when I was talking about VAERS is the cases of anaphylaxis.
Right.
So openvaers.com has reported that there's been a couple hundred cases of anaphylaxis and also 200 or so cases of Bell's palsy. And so Bell's palsy is like this facial paralysis, kind of half the face might droop or something.
Right.
And we actually saw a little bit of that signal even in the clinical trial data itself. There was only one case of Bell's palsy amongst the placebo group on both, if you combine all the data from Moderna and Pfizer together.
Right.
And there was, I think, around 7 actually for the combined trials. And so it may be the case that there's like a 3.5 to 7 times increase in the amount of Bell's palsy for the people who are receiving the vaccine. But
yeah, it's not an insignificant amount of adverse events.
Yeah.
And we know social media is being compromised. I had a patient of mine actually got the vaccine, and this is a parent, got the vaccine recently, had pretty severe side effects, posted it on social media. Now this is not an anti-vaccine person, just a person who, is aware that vaccines may have risks and is aware they should be reported. She's in the medical field. And immediately, they wouldn't put it up without putting a disclaimer from the pharmaceutical industry that these vaccines are known to be safe and effective.
Yeah, and they say like approved coronavirus vaccines, have been extensively tested for safety and efficacy, which is even more insulting because they haven't been approved. Not in the United States. They've just been authorized for emergency use. So it's like they're, just putting out blatant disinformation and totally gaslighting people's personal experiences.
Exactly. Thank you. That was very deep dive into the data, and I appreciate it because you were so clear and succinct. But you come from a functional nutrition background, and I'm aware that there are things one can do to, I'll just use the term boost your immune system. I mean, it's a robust immune system that helps you fight infection.
Right.
And this COVID-19 virus, especially with underlying conditions or if you're very old, it's a real deal. You want to optimize your immune system so you have a fighting chance.
Right.
What thoughts can you share with our viewers about what they can do?
Yeah, great questions. This is kind of like the alternatives, right? So if you decide I'm not going to get the vaccine for whatever reason, well, what else am I going to have in my toolkit that can help me support my health and immune system overall?
Right.
And I think in your last show, Bernadette mentioned that the Frontline COVID-19 Critical Care Alliance had put out a protocol where they were recommending ivermectin.
Yeah.
And I've also written a blog post about that where I mentioned that as well. And in addition to ivermectin, they also recommend a handful of nutrients or nutritional supplements in addition to that. And so as you mentioned before, and as even today, vitamin D3, critically important. Yeah, we see that people who are deficient in vitamin D are more likely to have a poor outcome if they get COVID-19 and vice versa. So vitamin D3 is key. Also vitamin C and zinc. And they also recommend quercetin, which as I understand is a zinc ionophore. It helps zinc get into the cell to help stop viral replication inside the cell. And melatonin, which is something that I think that you've mentioned. So those 5, so vitamin D, vitamin C, zinc, quercetin, and melatonin are all things that you can think about considering. And in addition to that, I have one more that I want to mention. I've written a blog post on my website, which is gutresolution.com. It's iodine. So, and this is something that I haven't heard many people talk about actually. And so it's really interesting. So they've done laboratory test tube studies or laboratory studies, and they found that even at a low concentration, iodine will inactivate the SARS-CoV-2 virus in as little as 15 seconds. You could probably just go and find an iodine mouthwash, like a mouthwash that contains iodine, and if you feel like you have a little bit of a sore throat coming on, maybe you came into contact with someone who's COVID positive, and you want to like do something proactive, you could just kind of gargle this iodine rinse for maybe 30 seconds and then spit it out. And
I mean, we use iodine to sterilize water, right? If you're camping and hiking, you put some iodine tablets or drops.
Yeah.
Yeah.
It's a sanitizer.
Yeah. And our bodies need a certain amount of iodine. Do you know how the safety profile looks for use of iodine?
It's really, really tricky with iodine. So yeah, iodine is an essential nutrient. Yeah. We do need iodine. The recommended daily amount is actually very small.
Right.
I think it's less than 200 micrograms per day. That's what's recommended to people.
Yeah.
But so, within my scope of practice as a nutritionist, I don't really feel comfortable recommending people take more than the recommended tolerable upper limit for things. And some people will recommend taking like 25 milligrams a day. But if you have certain thyroid conditions, you really do need to be careful about the dosage. So it's the dosage of iodine that's really, really important. And too much iodine can be harmful. Yeah. Even if you did it as like a hand sanitizer. I heard that they used to use iodine hand sanitizers, but then they were getting too high iodine levels, and so they cut that out. Yeah. So dosage is very important with iodine. I would say work with your trusted healthcare practitioner to determine what dose of iodine is right for you. But as far as like using iodine as a gargle or mouth rinse, or maybe even like a nasal spray or nasal rinse, you don't have to worry about that as long as you're not making your own using drops and doing it too much. So that's just one little tip that I want to leave people with.
That's wonderful. Well, this has just been amazing information. I'm thrilled you came on our show.
Thank you for having me.
You've done an amazing job. That camera is your audience. If you have any parting words, feel free to address them.
Sure, yeah. So if you'd like to follow any of my work regarding health-related information, you can go to my website, gutresolution.com. And I also created a free online course on vaccines called The Dark Side of Vaccines, the less publicized story of vaccine safety and efficacy before all of this COVID stuff happens. So you can go to my website, darksidevaccines.com, click on the courses tab, and it's a free online course. It goes over the historical vaccine safety concerns of the past, which I think are good to know about as we move forward and with this whole new vaccine rollout with the COVID situation, because it's important to know this isn't our first time facing a supposed respiratory epidemic where we had a mass immunization campaign, and in the past it didn't work out so well. So it's good to know history. So I'll just, if you want to follow my work, they can do it that way.
That's awesome.
Yeah, thank you so much, Paul. It's been a pleasure.
Really good to have you on the show.
Thank you.